Breathe in, breathe out. It seems simple, right? But behind this simple act lies a complex and fascinating process that keeps us alive. Our lungs are incredible organs, working tirelessly to ensure our bodies get the oxygen they need and expel carbon dioxide. But what happens when this process doesn't work as it should? That's where lung function tests come in. But what if your lungs aren't doing their job? What if you find yourself short of breath, wheezing or coughing more than usual? These could be signs that your lungs need some attention. Lung function tests are essential tools that help doctors understand how well your lungs are working and identify any potential issues. Let's crack open the world of lung function tests. These tests are designed to measure different aspects of lung function, providing valuable information about your respiratory health. They can help diagnose conditions like asthma, chronic obstructive pulmonary disease, COPD, and other respiratory disorders. By understanding how these tests work, you can take an active role in managing your lung health. Lung function tests, or pulmonary function tests, are like a fitness test for your lungs. Just as you might take a fitness test to assess your overall physical health, these tests evaluate how well your lungs are performing. They measure various aspects of lung function, including how much air you can inhale and exhale, how quickly you can do so, and how efficiently your lungs can transfer oxygen into your bloodstream. They measure how well you can breathe and how effectively your lungs can bring oxygen to the rest of your body. This information is crucial for diagnosing and managing respiratory conditions. For example, if you have asthma, these tests can help determine the severity of your condition and guide your treatment plan. If you have COPD, they can help monitor the progression of the disease and assess the effectiveness of your medications. Imagine your lungs are like a pair of balloons. When you blow them up, you want to know how big they can get, how strong they are, and if there's any blockage in the airflow. This analogy helps illustrate the different aspects of lung function that these tests measure. Just as you would check a balloon for leaks or blockages, lung function tests can identify issues like airway obstruction or reduced lung capacity. When you blow them up, you want to know how big they can get, how strong they are, and if there's any blockage in the airflow. This is exactly what lung function tests do. They provide a detailed picture of your lung health, helping doctors identify any problems and develop an appropriate treatment plan. By understanding the results of these tests, you can take steps to improve your lung function and overall health. That's exactly what these tests do. They measure different aspects of lung function, providing valuable information about your respiratory health. For example, Spirometry measures how much air you can exhale in 1 second and the total amount of air you can exhale after taking a deep breath. This information can help diagnose conditions like asthma and COPD and guide your treatment plan. There are several types of lung function tests, but let's keep it simple. Each test measures a different aspect of lung function, providing a comprehensive picture of your respiratory health. By understanding the purpose and process of each test, you can feel more confident and prepared when undergoing these evaluations. One common test is spirometry. This test measures how much air you can exhale in 1 second and the total amount of air you can exhale after taking a deep breath. It's a simple and non-invasive test that provides valuable information about your lung function. By measuring the speed and volume of your breath, spirometry can help diagnose conditions like asthma and COPD. It's like blowing into a tube to see how much air you can push out and how fast. During the test, you'll be asked to take a deep breath and then exhale as forcefully as possible into a tube connected to a spirometer. The spirometer measures the amount of air you exhale and the speed at which you do so. This information helps doctors assess your lung function and identify any potential issues. This helps detect conditions like asthma or COPD. By measuring the speed and volume of your breath, spirometry can help diagnose these conditions and guide your treatment plan. For example, if you have asthma, spirometry can help determine the severity of your condition and monitor your response to treatment. If you have COPD, it can help assess the progression of the disease and the effectiveness of your medications. Another test is the lung volume measurement. This test measures the total amount of air your lungs can hold, providing valuable information about your lung capacity. By understanding your lung volume, doctors can identify conditions like restrictive lung disease, which can limit your ability to take in air and affect your overall lung function. Think of it as checking the balloon's capacity. Just as you would measure the size of a balloon to determine its capacity, lung volume measurement assesses the total amount of air your lungs can hold. This information is crucial for diagnosing and managing conditions that affect lung capacity, such as restrictive lung disease. It measures the total amount of air your lungs can hold. This test provides valuable information about your lung capacity, helping doctors identify conditions that affect your ability to take in air. By understanding your lung volume, you can take steps to improve your lung function and overall health. This can reveal issues like restrictive lung disease. Restrictive lung disease can limit your ability to take in air, affecting your overall lung function. By measuring your lung volume, doctors can identify this condition and develop an appropriate treatment plan. Understanding your lung volume can help you take steps to improve your lung function and overall health. Diffusion capacity tests measure how well oxygen moves from your lungs into your bloodstream. This test assesses the efficiency of gas exchange in your lungs, providing valuable information about your respiratory health. By understanding how well your lungs can transfer oxygen into your bloodstream, doctors can identify conditions that affect gas exchange, such as emphysema or pulmonary fibrosis. It's like seeing how effectively your lungs can handshake with your blood cells. This analogy helps illustrate the process of gas exchange in your lungs. Just as a handshake represents a connection between two people, diffusion capacity tests measure the connection between your lungs and your bloodstream. By understanding this process, you can take steps to improve your lung function and overall health. Understanding these tests can help diagnose and manage respiratory conditions, ensuring you breathe easy. By understanding the purpose and process of these tests, you can take an active role in managing your lung health. Whether you're dealing with asthma, COPD, or another respiratory condition, these tests provide valuable information that can guide your treatment plan and help you breathe easier. So next time you hear lung function test, you'll know exactly what's going on inside those amazing balloons in your chest. By understanding the different types of lung function tests and what they measure, you can feel more confident and prepared when undergoing these evaluations. Remember, your lungs are incredible organs that play a vital role in your overall health. Taking care of them and understanding how they work can help you live a healthier, more active life.